Today's episode is brought to you by Microsoft Dragon Copilot, your AI assistant for clinical workflow. Learn about how Dragon Copilot can transform the way you work. Stick around after the episode or visit aka.ms/knock knock hi. Again, that's aka.ms/knock knock hi.
Hey, Will,
Hey, what's up?
I've been thinking the U.S. healthcare system, it needs some improvement.
Yeah, there's room for improvement for
Yeah,
sure.
it's a confusing, scary place for everybody involved.
Absolutely.
Physicians, families, patients, everybody.
Everybody. And I've experienced it from both sides, right? I'm a physician. I've also been a patient. So I wanted to use my platform to give people practical education, really the only way that I know how, by making jokes. So Dr. Glaucomflecken's really fun and super uplifting guide to American healthcare is out, and it's a free resource that includes all my videos from the 30 Days of Healthcare series, alongside deeper explanations, also reliable facts, emphasis on reliable,
Yes.
all right? Figures, numbers, insights into how each of us can fight for a more humane, better healthcare system. Also, it has jokes.
Did you mention the jokes?
I did. Jokes.
Okay.
Yes, definitely jokes.
Well, this guide is great for anyone looking to learn more about U.S. healthcare, but especially if you are experiencing it from the clinician side for the first time.
That's
We
right.
really hope you'll check it out.
Get the free guide sent straight to your inbox by signing up for our mailing list, glaucomflecken.com/healthcare. Enjoy.
Knock, knock. Hi.
Hello, everybody. Welcome to Knock Knock Hi with the Glaucomfleckens. I'm Dr. Glaucomflecken, also known as Will Flannery.
I am Lady Glaucomflecken, also known as Kristin Flannery.
Welcome to Glauc Talk. I hope everyone's having a wonderful day. I'm recording this on the eve of my 40th birthday.
That's right. How you feeling?
I'm okay. I've accepted it. I don't know. It's like, what are you supposed to have accomplished like by the time you're 40?
I think you're good. Like, I don't know how much more you
I
could
guess.
want.
Well, no, it's not that I don't want like more than I have. It's just like am I doing all right? I think I'm doing
That's what I'm
okay.
saying. I don't know what else you might accomplish. Like, I
Eh,
think you're good.
It'd be nice to have a testicle or two. I
Well,
mean, like there's
this
some
is the price we pay. You know what my theory is that your life has been so charmed in terms of just like your career. You had a good childhood, you had good parents, you went off to college, you got good grades, you went off to med school, got whatever that is, AOA or whatever the med school version is. No, that's ophthalmology. What's
no
the med school one?
OA is OAO is the Oregon Academy of Ophthalmology. AOA is
Is
the
the honors.
honors
Yeah.
thing. Yeah.
So, and then, one of the best ophthalmology programs in the country, a very competitive specialty. You got right in. Oh, just
All
like
right,
thing
all
after
right,
you
all
have a
right,
good
all right.
job
That's
on the
okay.
first
All right, we
try.
got it.
Then you have
Yeah. All right.
your personal life has gone well
I
for
didn't
you. So
say
you had to have something.
I didn't
This
say
is my
I'm
theory that the universe had to even it out in some way.
Oh,
It
I
was
see.
too
I see.
good. You can't have that much good. It's selfish.
I see. Okay. So it's has to I see, that's why. Okay.
Yeah.
Got it. Well, I'm just
So
glad
it's
you're
just like
around.
karma,
I'm just
balancing it out. No,
I'm
that
just
wouldn't be karma.
no.
What would that be?
I don't
It's like
know.
homeostasis, but on a
Yeah,
cosmic level.
yeah, cosmic homeostasis.
Yeah.
That's a good name for something. I like that. It rolls
Yeah.
off the tongue.
It's like a
Cosmic
nerdy
homeostasis.
science rock
I didn't
band.
say I'm not feeling like I haven't accomplished everything. I was just like, you know, half my life, maybe even more, is over.
Yeah, me too.
Is that too pessimistic a way of thinking about it?
You tend to be a glass half empty kind of guy.
Am I?
Yep. I
Okay.
tend to be more of the glass half full, but we even each other out.
So what are you supposed to do in your 40s? Like, is there like
Here's what
what's
I think about my 40s, and it's
okay.
much brighter than where it sounds like you're thinking.
I don't know what I'm thinking right
I
now.
think in the 40s, you It's like prime life because you're still young enough to
Yeah,
have like a decent level of health. We got aches and pains and it's easier to
sure.
injure ourselves or whatnot. But like for the most part, we
Yeah.
got energy, we got physical health.
I can still
We're
lift heavy
good.
weights.
Yeah,
Yes.
exactly. You got a family, your kids are still at home. That's
Yeah.
fun
Yeah.
sometimes. Uh and you've got, things going on in your life
Mhm.
that you enjoy, at least in our case, we like our jobs. And then you also don't care anymore, at least I don't, like what other people think so much. Like in
Yeah,
your 20s and
that's
you're
true.
you're like really concerned about that and
Yeah.
like what will people think of me and I got to make something of myself and that's like appropriate for your 20s and
Yeah.
what you're trying to do then. But like in your 40s you're like I did it. I'm done. I don't care anymore. And now you get to just like enjoy the fruits of your labor.
Are we at the point where we're enjoying our fruits?
Yeah.
Yeah, I'd say so.
Yeah.
We're definitely enjoying our
We've
fruits.
gotten many of our life goals
We've
checked off
we've
at
gotten
this
s
point.
we've gotten some fruits,
Yep.
and they're nice, sweet
Mhm.
fruits
But you still have the trees,
with
you know? You
the
still have there's more coming.
the random what persimmon that we don't know what to do with, but
Yeah.
mostly it's good fruit that we like,
Mhm.
and
Only a few worms.
yeah, just a few little things, but overall, yeah, I agree, good
Yeah.
fruit.
40s
All right, all
is a
right,
good
this is
decade.
prime.
I think
All
so.
right, good. Well, I did write down the medical things that happen in your 40s.
Okay.
So presbyopia is number one.
Yes.
All right.
Mhm.
Now you are lucky. You are not going to feel the effects of presbyopia.
That's not entirely true. I do a little bit. Like when I
How?
have my
Oh, when your contacts are in?
contacts in,
Yeah. Yeah.
then I notice I move
Yeah.
away a little bit.
We were talking about this yesterday.
Mhm.
I was sitting there, sitting in the living room in the chair, and you were on the couch on your computer, and I look over there. You're just like
Rubbing.
palm to the eye,
Yeah.
just going to town, rubbing
Oh,
it,
it's my left eye. It's always that one.
squinting.
Yep.
You get the weird blinks. What's going on? And it's like, Kristen, what what's happening? And then you're like, oh, my eye just hurts. I was like, well, do you have your contacts in? You're like, well, yeah. I was like, take them out. And then you pretended to take out a contact. It's like, listen, folks, if you haven't learned from me by now, when you're a contact lens wearer and your eyes hurt, don't wear your contact lenses. There's a reason your eyes hurt, and
Okay,
it's very easily because of your contacts that your eyes work,
I did take them out a
that
little
your eyes hurt.
later, and it did stop hurting. However, I
It's almost like I know what I'm talking
it's
about.
not that I don't believe you. I'm just lazy. I didn't wanna get up and
And
go
I,
get my glasses. If I just took it out right there, I wouldn't be able to see my work.
yeah, and I was like, well, I told you, I was like, take your contacts out, go put your glasses on. And you know what she told me, everybody? She said, I don't have all my glasses are old lady glasses.
That's not what I said at all.
You said all the only ones we sell at my office are old
Oh,
lady
well,
glasses,
that's not exactly what I
which is
said
where you
either.
got all your glasses from, is my
What I
office.
said is that I currently don't have any glasses frames where I like the way they look on my face. Like it's fine for at home, like
Okay.
reading in bed or whatever, but like I don't have any that I feel like I could put on and like confidently walk around in the world. Cause this is a thing that you don't get as like a perfect vision person. Again, too perfect.
Charmed life.
Yeah. Contacts, you just see it from the ophthalmological side,
Yeah.
but contacts are sometimes about vanity. I'll just say
See,
it.
but I'm gonna push back because right now glasses are so in.
They are, but, like, you still need to
They're
feel good
fashionable.
about the ones you have, just like your clothes or whatever. You don't wanna wear something that you feel like,
Plus,
"This is ugly."
you know how many times I've been able to sell glasses on people to get them out of contacts because, like, hey, glasses, they'll hide your wrinkles. They'll
They
hide
do not.
they'll hide the bags under your
No,
eyes.
they don't.
Absolutely they
No, they
do. Are
don't.
you
They're
kidding
clear.
me?
You can see right through them.
Look at where the frame sits. It's right.
Down below for me, my
No,
glasses frame sits right
I'm
there,
telling you, no.
right on my cheekbone.
Glasses, if you get the right kind of frame, it'll hide some of the things that people don't like about their face as they get older. Now
Well,
you don't have any of those issues, but so it's not an issue for you, but eventually.
yeah. I don't know.
So anyway,
I need some glasses that I feel like these look good on my face for my face shape.
okay,
They make me feel like me, not like me wearing a costume. That's what all my glasses kind of feel like right now. Is like these
'cause
are
you're
just
wearing a
like not
costume.
me.
Well, we'll
They're like a prop.
we'll go to the young person optical, whatever the hell that is. All right.
I don't think I
So,
said old
okay,
lady. I think I said boring.
you totally said the words old lady
I have
glasses.
no memory of that.
All right. Well, that's because you're 40. But is presbyopia is it bothering you yet? So you're wearing your contacts and you're
Mhm.
starting to have trouble with while you're wearing your contacts, you
Yes,
can't
when
see
my
up
vision
close
is
very well.
corrected, I
Yeah.
do need to move things back a little further, not much, but just a little
So
further than
what
I
are you
would have.
so what are you gonna do?
Just
What's
move it back.
no, as you go through your 40s, let's say you
Yeah.
turn 50 and you're really like that near vision when you're wearing your contacts.
Yeah.
It's not good anymore. Are you the type of person that's going to want to wear progressives or bifocals? So progressive is like a no line bifocal,
Yeah.
right? Talk about old lady
I've
glasses.
heard that people don't
Bifocals.
enjoy the experience
The
of
progressives,
Mhm.
not when they're 40, maybe not when they're 50, but as you get older, you accept it a little bit better.
Mm.
But the other option for someone like you who's a -3 myope,
Minus 3.75.
yeah, is just wearing your distance glasses and you take them off to read.
Yeah, which I might do because I do much more up close work. I work on computers all day and I read and I write and I do things that are very close to my face.
Or I have one other option for you,
Hmm.
just taking the contact out of your left eye.
But then I can't see very well and it gives me a headache.
Well, you have your right eye to see distance. Your left eye sees near.
That gives me a headache.
Does it? You
That's
don't
the
like
thing
it?
that people don't like about progressives, right? That you have
No,
this
no,
like,
that's more what I'm talking about is monovision. One eye distance,
yeah,
one eye near, and people it does decrease your depth perception, so
yeah,
that's
that's
what
a problem for
bothers people.
driving and stuff.
Some people who can tolerate it though, they love it, and it really is a nice thing to be able to do. But anyway, that's
Yeah.
not you. So,
Is there like a period of accommodation where you have to get used to it?
a little bit, but usually you can tell pretty quick within a week, like, yeah, like, you do it for a few days, and if you still, like
See, that sounds like no time at all to you, but going about my life for a few
Not
days
don't do it now, you
trying
don't
to
need it now, you're only
Oh, okay.
40, once you're 45, we'll talk
Maybe it'll
again.
work back because right now
Yeah,
it does
yeah,
not
yeah,
work,
I
but
wouldn't expect it to work yet.
okay, gotcha.
Okay, so we have presbyopia in your
Mhm.
40s.
My eyes get drier.
The
I didn't used to
yeah,
have that problem.
well, god dang it, Kristen, it's the contacts. You wear them like 18 hours a day. How many
I
times do I have
like
to
my
tell you?
contacts.
I know you do.
You'll have to pry them out of my
I
cold, dead eyes.
I don't I will I've there have been some times when I've, like, thought about while you're sleeping, like, checking to make sure you're not wearing contacts.
I only sometimes
I
forget.
don't wanna hear nothing about no dry eye from you while you're still wearing your contacts that frequently, because you know what to
Well,
do.
I just get a bottle of Refresh.
Mhm, okay.
That's what
So,
I
anyway,
do.
the other thing I wrote down for medical things in your 40s is colonoscopy.
Yeah,
That's
45, right?
coming,
That's what
45 for average risk, people of average risk, the
Mhm.
recommendation is at 45, you get your first colonoscopy.
I feel like in the
We
year
should schedule on your
20
birthday.
no, I'm not gonna do that. But in the year 2025,
Yeah.
it seems kind of wild to me that we do not yet have a different way to do that,
There
to screen for that.
well, there are different ways. They have, like, virtual ways, like, imaging ways of doing it. The problem is, like, I don't know what the data is on, like, the false negatives, false positives,
Mhm.
but, if they see something
Say something.
on the imaging
Mhm.
that might be some kinda possible polyp, well, then
Mhm.
you still gotta have a colonoscopy.
Okay, but then if they don't, then you don't.
What the
And
how do you
probably
know for
chances
sure?
are you're not
But then the
if
question
you're
is, okay,
average
well,
risk.
what about just getting like a sigmoidoscopy where
What
you
is
don't
that?
so it's just a colonoscopy, but it only goes like a smaller amount
Still don't
into the
like it.
rectum and into the sigmoid colon.
Nope.
No.
No thanks.
You just don't like the idea of having a camera
I
in
well,
your
it's not so much that Well, do you get to be anesthetized, first of all?
I am absolutely asking for propofol when I get my colonoscopy.
Okay. Do
I
some
wanna
people
be
do
out.
it? Oh, yeah, I guess
Yeah,
they
people can
do.
do
Katie
it
Couric did hers
people
awake.
can do
That
it
was the whole
awake.
thing.
I think it's if you're making content, you definitely
You
want it to be
want to be
awake,
awake?
but I'm not. I don't feel like I need to broadcast my
I would like
my transverse
for
colon.
Dr. Kavehoda to do your first
Colonoscopy?
colonoscopy, and I will be there filming.
Okay, let's do it. Let's do
And
it.
we
As
can put
long as
it
I'm
on this
asleep,
podcast.
do whatever the hell you want. It's fine. Alright, so I have presbyopia, colonoscopy. That's I'm taking a statin. I
You
got
are?
that. I
Yeah?
got a little my high cholesterol runs in my family, so
Hmm.
it's like I'm trying to get
Yeah,
that
that was
under
just a matter
control.
of time.
But, anything on the women's health side?
Well, perimenopause,
Oh, yeah, okay. Alright. There
it
you go.
starts
What's the
lots of different times, but the 40s is one of them.
what's the exam situation? Are you going in for yearly exams at this point? Like, do you have to get a
Good
pelvic
question. Do
exam,
you know
like,
what?
every
I feel like COVID really
just
messed
messed it
up
up?
my gynecological care. Like I could no longer just make an appointment with a gynecologist.
You
I
have to
had
get a
to
virtual
go
pelvic exam?
I had to well, you had I don't know if this was just like here
I don't
in
think
my
that exists.
experience or a wider experience, but what I was told is I would have to go to my PCP
Mhm.
and they would determine whether I needed a gynecological appointment.
Mm, 'kay.
And they were gatekeeping essentially. And it was like
I see.
a little difficult. Like
Sure.
it was just like the more serious stuff that they would allow to go through.
I see.
So,
That's
and
probably
then ever since
relaxed
then,
at
it's
that
just
point.
yeah, but like the routine gets
Right, right.
thrown off and now I don't even remember where I went
You
and
should
who
probably
it
check in.
was.
Probably a good idea to just check in.
Well, I did go to somebody recently, but it was a new person. Like not where I went before. I know
I
that.
but I keep getting yelled at by him, but on my chart for not like, I gotta get my
You
levels
are
checked. I got
the worst at maintaining your own healthcare. The worst. You have
I deserve
you
that.
need to check with an oncologist,
Oh, no.
cardiologist,
Oncologist, I'm done with that. I'm done with that.
urologist. Okay, okay.
Oncology,
But
I'm done
like,
with that.
okay, fine. Still the others.
Okay, I would say I
Endocrinologist
no,
every
no,
once in a
no,
while,
no, no.
maybe.
I see my urologist every 3 months.
Okay, do they do the endocrinology pieces
They
that need to
check
be done?
yeah, they check they order labs. I get
Okay,
those
when's
labs
the
done.
last time you were
My
in contact
PCP is the
with your cardiologist?
ooh, yeah.
And you no longer are using the heart monitor that you're supposed to be using that your little
I'm
device in
sure the
there
thing
sends data
still
to.
works.
I know, but that's not why you
Alright,
use that.
okay.
Use it to collect the data so they can see because it was idiopathic.
So medical things in my 40s, go see my cardiologist.
Yes.
Alright. Anything else
And your
before we
PCP.
move on?
You brought this up.
I did bring this up. Okay. So, I'm kinda looking forward to my colonoscopy. I wanna see a video of it. I
What?
definitely I wanna see I wanna have them to record it. I wanna see what's going on in there.
I don't think it's the procedure itself that most people have an unpleasant
Oh, I
experience
know.
with.
It's the prep,
Yeah.
the go lightly.
Mhm.
I'm gonna get some good content out of that, I'll tell you that for sure. Not like I could make a skit about it. I need to
Okay,
experience
okay.
it.
Yes, okay.
Yeah, I
Well,
gotta
what was I
record
supposed
videos
to
of
think when
myself
you
sitting
say
on
it
the
like that?
toilet. Dear God, what do you take me for? Some kinda weak content creator?
Mhm.
All right, what I wanna do so we're gonna do a medical topic. By the way, people like the medical
Yeah?
topics. Yeah, yeah.
Nice.
We talked about, the cancer drugs, and people were like,
Oh,
"Oh,
yeah. Yeah, we got a lot of comments on that one.
thanks for talking about methotrexate." So I think we're gonna, like, keep doing it, you know? Do
Okay.
you remember our discussion about methotrexate?
I remember talking about cancer drugs.
Yeah, anti-metabolite,
I don't remember
to
the
folic acid,
specifics.
stuff like that. Anyway,
So,
alright.
your lesson
Go back. You
didn't
guys
stick.
go back and watch it. By the way, all the comments, we read all the comments on our YouTube channel at Glauc and Flecken, so definitely
That's
check
right.
that out. So I'm gonna get to some, you know what? Let's take a quick break.
Okay.
I got a couple of things with the comments that I wanna talk about. Hey, Kristen.
Yeah?
You know what it's time for?
What?
More Dex Blepharitis talk. We're not
Yay!
talking about mites today, though.
Okay, phew.
All right. I've mentioned the crusties. Remember the crusties?
Mm,
The
oh,
collarettes?
yes, I remember the
Right? It's a
eyelid
telltale
crusties.
sign of Dex Blepharitis. I just want to educate people that you can't always see these things in the mirror.
Mm.
Sometimes you need magnification, the equipment we use in the eye clinic to be able to diagnose this.
So some people might not even realize it when they have Demodex blepharitis?
Exactly. Often patients don't know they have those crusties
Mm.
and can't connect their symptoms of redness, irritation, itchiness to Demodex
'Cause that
blepharitis.
just sounds like allergies.
It can be. It's also a great time right now to make an appointment with your eye doctor before the end of the year when deductibles reset.
Ooh, good point.
Yeah. To see more pictures of crusties and eyelids with Demodex blepharitis, visit miteslovelids.com. Again, that's miteslovelids.com to learn more. This ad is brought to you by Tarsus Pharmaceuticals. All right, so YouTube comments at Glauc and Fleckens. So, one thing was like a lot of the, people liking the random medical topic thing. But I guess some stuff about the veterinary care. Because
Oh,
remember we talked about a couple
yeah,
weeks
you went to a
ago.
conference.
Yeah, I went to a big veterinary conference and had a great time. Held a puppy. Just hung out with all the vets. A
You
fantastic
know what
crowd.
they need at a veterinary conference? Because the puppies are becoming a little mainstream at
Yeah.
this point. You know what they need?
What?
Baby goats.
Baby goats.
Yeah,
Okay.
just putting that
Just
out there.
how about baby, like, exotic animals?
Baby goats are the cutest things.
Like, how about baby bears?
I don't I don't think that would go well.
No, you don't think so?
I don't think so because my first question is
Where do you get the
where's
baby bears?
yeah, and then where's the mother? Probably not there.
Alright, maybe not bears,
So
okay.
then that's
How about,
sad.
like, baby llamas, you
That would
know?
be
Like,
cute.
something like that.
Baby alpaca.
Yeah, baby alpaca. Let's get some baby alpacas. I think that'd be really
If
fun.
anyone
I've
can
never
do it,
seen
it's
a
the
baby
vets.
alpaca. So anyway, a couple good comments here. Let's see here. Oh, here's one. At Melissa Glasser 4759. Equine neonatology was a thing when I was in vet school. So we talked about
Wow.
how one thing I learned at that conference was that they started the very first neonatology. There's like only one neonatology program and it was just started. And so
Mm.
it's like a new real kind of a new thing. It's not very common.
Mhm.
So I was like, would they even have any
Yeah.
neonatology?
When I
Well,
was, in high school, I dissected a pregnant cat in science class. That was kind of neonatology.
okay. And so equine neonatology, how'd you do with your dissection? Were you good at
We
that?
were good. Everyone had to dissect a cat, but only the best students got the pregnant cat.
Forgive me for saying this, but you don't have surgeon hands.
I do not. They are
Um,
quite shaky.
so equi- if you were and went to med
But you
school,
know
you
what?
would
The
not
cat
be a
was
surgeon.
dead, so it didn't matter.
It's okay. Equine neonatology was a thing when I was in vet school, 87 to 91, although it's a very seasonal business.
Well, true.
Horses foal in the spring for various definitions of spring. It also tends to be more common in regions with large populations of high priced horses.
Mm.
So you want
Yeah,
to do,
because you wanna make sure that
yeah,
that baby in
like
there is
Kentucky,
coming along well.
like Kentucky, Florida, California. I guess those are popular places
I get
for
Kentucky,
horses.
I don't know about
I think it's
I'm
just,
just ignorant on Florida and California horses.
it's probably just like warm,
Like
maybe.
ranches, maybe
Yeah,
in
yeah, and
California.
it's warm. It's
Yeah.
like, horses, they don't, if they get cold, you gotta put a blanket on them. So if I was
That's the issue.
yeah, like if I was a
The warm
horse,
horses are the high price
if
horses.
I was a horse, I'd wanna be warm. I'd wanna be in a warm state. Why would I wanna be in a
Mhm.
cold state? Like, you're not gonna see horses in freaking Massachusetts.
You can charge higher prices if you're warm. High
No,
price horses.
that's just where the best horses go, I guess. They
They're
migrate down.
snowbirds.
Yeah, they exactly, absolutely. Um, people, shouted out Milo. We talked about
Oh,
Milo.
Milo.
It's nice. Here's another, comment at Turtle I8Y said, "Thanks for the episode. You mentioned not having been to an OBGYN conference, which made me wonder, have you had an episode about how pregnancy affects the eyes
Mm.
or any eye problems that are increased in frequency or severity by pregnancy?"
Are there any?
So that's
Well, you gotta save it for the episode, but are there some?
yeah. Yeah, well, I'll say it now because, well, first I wanted to ask you, did you notice any changes in your vision
No.
at all?
Mm.
So, 2 things. One is your prescription can change with hormone changes.
Mhm.
So, some people get a little bit more nearsighted or they have a little bit more trouble with reading, with near vision.
Hmm.
Um, I would say probably the bigger one is just fluctuations in blood sugar for patients with diabetes.
Oh, okay.
Yeah, because that
Yeah.
that can change your vision. We also so that's why when patients are pregnant or breastfeeding, we don't change their glasses. Like
Yeah,
they'll
because
come in with
it
blurry
might go
vision
back
'cause it's
to.
gonna change. It's gonna fluctuate with breastfeeding or it's all the hormones. They do crazy things, hormones.
Yeah, they
So,
do.
um, and one person asked if Milo spoke at the conference. Nope, he's a dog.
Milo seems like a slug.
Good boy. Yeah, his when he's in here while we record, he's not in here today, but he is a little sluggish. All right, so let's should we get to a topic?
Yeah.
You want to talk about something?
What are we going to talk about today? Let's find out.
You are going to tell me. So, let's see. Choose as so I have my trusty first aid for the USMLE step 1.
Mhm.
I'm going to end up reading this more than like my original first aid. You know what
Yeah.
year my first aid was?
2008
I think I got
ish.
I was I was
No
I
later
was
than that.
I was, uh I was working off of 2009,
Oh, 2009. That was
2009. My
brand new.
second year of med school.
Oh, it's a second year thing, not a first year
Well,
thing.
it I think by the time I got mine, they had started making the 2009
Okay.
version, so
Yeah, because that probably comes out in
yeah, yeah,
2008,
yeah,
actually.
yeah. So anyway, all right, choose a page from 32 to 706. Dun, dun.
444.
444. I have the right of refusal if this sucks. 444. That's the same
Have I guessed that one?
page you had me do
I
the
did that
first time.
before?
Yes.
Okay.
How is that even possible?
I
You
don't
chose
know.
the same
I don't know. You
number.
know what I do? I close my eyes and I wait for a number to pop up in my mind, and I
So
say that.
444 means something
I
in your
guess so.
subconscious. Talk about that with your therapist.
Yeah.
What is it about
It's
444?
a good number. I
All
don't
right,
know.
give
How
me
about
some
333 then?
your brain. What's going on in there? Jeez. 333. Oh, we got
Oh, speaking of hormones.
yeah, we got some hormone action, some endocrinology. How about we talk about growth hormone?
Okay.
And then maybe if we have time, we can get into some antidiuretic syndrome.
Mm,
Sorry, not syndrome,
hormone.
antidiuretic hormone. So the pituitary,
Yes.
you know what the pituitary, it's the testicles of the brain. You're aware of the pituitary.
Yes, I
I know you
am.
are. Um, so growth hormone is one of those hormones that's secreted from the anterior pituitary. Uh,
Secreted is a gross word.
sec-
You know?
you don't like secrete?
Yeah, it's in the category of
Extrude?
moist.
How about extrude?
I mean, there's no good word for it. It's just
Produced?
okay, I'll do
Produced is
that.
fine, but secreted tells you like exactly how it comes out.
Yeah, that's
It
why
gets
it's gross.
it's kind of
You're
that
just helping my
that's the sound
point.
that's the sound it
Mhm.
makes, the pituitary makes as it squeezes out
I'm
juices,
sure it does.
hormone juice.
Yeah.
So within this hormone juice, you
Mhm.
have growth hormone. But do you know what sends the signal to the pituitary to produce that hormone?
Tell me.
Do you know?
I did at
The
one
smarty
point.
pants?
I have forgotten
The
who the
hypothalamus.
yes, I was gonna say the HPA axis is the thing.
That's right.
So H.
Hypothalamus pituitary axis. So the hypothalamus, it produces growth hormone releasing hormone.
Mhm.
All right. It goes down this little stalk. Basically, it's like the thing holding up the testiball, the pituitary balls
Mhm. Okay, I'm just
to
gonna let that one go.
the pituitary balls. It goes to the anterior part of the pituitary. It stimulates it to produce growth hormone, and
Mhm.
then that growth hormone it stimulates. It goes to a lot of different things. Uh, the most direct pathway is right to the liver.
Interesting.
Um, to produce. So it goes to the liver and it causes the liver to make a molecule called IGF-1,
Mhm.
all right? And that IGF-1, it leaves the liver and it does several things. So it goes to your bones,
Okay. What does IGF stand for? Something growth factor?
insulin-like growth
Okay.
factor type 1.
Okay.
Um, and what it does is it goes to it promotes like strength, it strengthens and grows your bones.
Mhm.
It strengthens and grows your muscles.
Mhm.
So when say strengthen and grow, I mean like it increases protein synthesis, increases amino acid uptake. Remember your amino acids?
No, not anymore.
That's okay.
I'm
Um,
40.
DNA and RNA synthesis.
Mhm.
It increases the size of your cells in those. That's why it's growth. It's like
Mhm.
it's
It's
making everything
growing.
growing, right?
Yeah.
Everything you need to that for growth of these tissues. So it does that for bones and muscle.
Okay.
So that's why people with like growth hormone, like the most common one is oh, what's the one? Uh
Marfan syndrome?
no, it's the one that people get in their like 50s, 60s that makes their remember Jaws
Oh,
from the Bond movies?
no, I don't.
Acromegaly. That's what I'm thinking of.
Okay.
Acromegaly is a growth hormone uh
For your
overproduction
head.
thing. Yeah, it causes so but because by the time you get that disease, all your growth plates are fused,
Mhm.
and so you end up having growth of the tissue the only way it can kinda grows out.
Yeah.
It doesn't grow in
Like
certain ways.
noses and ears
Yeah, so it
and
gives you this very classic in your jaw and
mhm.
forehead, so it gives you this very classic appearance, acromegaly.
Mhm.
Um, and so but growth hormone also, uh so when it makes it produces the IGF-1,
Mhm.
which is the main acting on the inner organs, right, that we
Mhm.
talked about. But that IGF-1 also goes back and negatively it inhibits
Mhm.
the pituitary from making more growth hormone,
Mhm.
right?
It's
That's a
negative
little
feedback loop.
little feedback loop there.
Mhm.
What do you know about feedback loops?
It's exactly what we just said.
Do you know feedback loops? Is there feedback loops in psychology?
Oh, I wasn't expecting to be quizzed today. I would say they are not, if there are, they are certainly not as common as in biology.
When I do this, I'm becoming the full purpose of an attending
Yeah,
physician.
to just,
I'm supposed to ask you questions,
yeah.
and you're supposed to demonstrate your knowledge.
Okay, well, I don't get to have a
You're
book in front
supposed
of
to
me like you do,
demonstrate your knowledge on a topic you were just told about. All right, let's take
but you didn't tell me about
all right.
feedback loops in psychology.
Um, okay, hold on. Let's finish this up, and then we're gonna take one more break
Okay,
because
what
I got
is
another
that thing?
hormone for you.
Like a fatty cell?
Oh, the growth hormone. What you're talking about
Or is that just a picture of the hormone?
is in this diagram, the growth hormone is an arrow going to what looks like fat.
Yeah.
I have to remind myself, try to figure out what exactly that is.
Adipose tissue.
Yeah. Um, you know what? Let's not worry about it. Let's not worry
You
about
were
it.
just giving me this
Let's,
lecture.
don't talk, don't ask questions, don't answer, don't do anything unless I tell you to do it.
See what I have
So,
to live
but we
with.
did talk about excessive growth hormone, like disorders, like
Yeah.
acromegaly for
Okay.
adults, gigantism for kids. Have you ever seen a gigantic kid?
I have not.
Not a kid with not just a gigantic kid, a kid
Yeah, I
with
have seen it.
gigantism.
Right.
So same
No, I've
thing.
not seen one of those.
Pituitary adenomas can cause this. So there's a tumor of the pituitary, which we
Mhm.
will see in ophthalmology, because if you have a pituitary adenoma, then it can put pressure on the optic chiasm and
Mm.
give you visual field deficits.
Oh,
And then you have to go in and remove that. Do you
right.
know how they do that?
Oh boy. I don't think I wanna know.
They
It's
go in
through your eye socket?
no, they go in through your
Through your
nose.
nose. Okay, that's
Yeah,
better.
yeah. It's better? It's better? I guess it's
Yeah, then
better.
through your eye socket? You are desensitized to
You
some
could.
weird
I mean, you
stuff.
could possibly go through, so anyway, how about times of day when you have more and less growth hormone? Let's talk about that. So,
Nighttime,
you have
you have
in
more.
yeah, that's right. You have increased secretion of growth hormone during deep sleep,
Mhm.
not that light sleep,
Yeah.
right? The real deep, the real good one, the real good sleep.
I need some more of that.
So increased secretion during sleep. When you're hypoglycemic, you get more. I'm not
Mhm.
sure the mechanism for that is. Stress causes you to secrete more growth hormone.
Mhm.
I guess because you're trying to like give energy and stuff to your tissues to help you like deal with the
Mm.
stress.
Yeah.
Puberty, obviously,
Sure.
and exercise.
Hmm. Well, because of
Decreased,
muscles, I
de-
guess.
you get decreased secretion with aging. That makes
Mhm.
sense. We don't need to grow anymore.
Right?
Obesity decreases your growth hormone secretion. I guess because you already have like enough tissue
More yeah.
to
Right.
you don't need more um, amino acid uptake or whatever.
Or
Hyperglycemia.
whatever.
Yeah, that's pretty much it. That's growth hormone.
All right.
All right, you feel good about it?
Yeah.
All right, let's take one more break. Hey, Kristen, we're going to do something special.
What's that?
In honor of World Antimicrobial Resistance Awareness Week,
Mhm.
this month we're going to spotlight a podcast that's been host to some very powerful conversations about antimicrobial resistance. It's called the Sepsis Spectrum, hosted by Nicole Kupchik.
It's so important to get that information out there to people, and a podcast is a great way to do that.
It really is. Each episode is about confronting different blind spots in sepsis and antimicrobial resistance just helps educate people. And it's not just fluff. All right, it's not just cold academics and CME. These are real conversations about real stories about real patients. You can listen to the Sepsis Spectrum wherever you get your podcasts, or watch it on Sepsis Alliance's YouTube channel. To learn how you can earn free nursing CE credits just by listening, visit sepsispodcast.org. All right, a few more things about the anterior pituitary.
Okay.
Uh, do you have any guesses for other hormones that are released from the anterior pituitary?
Tell me.
I could tell you're not quite into this topic as you have in
You know
previous
what I
topics.
know what's going through my mind is,
What?
like, at one point I knew all this, and so this is just depressing that I have forgotten it all.
But why do you need to remember
You
this?
don't, that's why I've forgotten it.
You don't need to store any of this in your long-term
I
memory. Where does
guess.
that happen?
The hippocampus.
Yeah, yeah. So you still remember some things in your brain. You remember
And
things.
elsewhere. Then we get into locationism in neuroscience, and, it's just
The
probably
hell is
not that simple.
locationism? You
That's
just
the
made that
thing
up.
No, I did not. That's that thing where you say, "This area of the brain does this,"
No.
and only there,
Yeah.
whereas the brain is actually more complicated than that, and there's a lot of networks and a
Also,
lot of feedback
locationism
loops.
locationism is misinformation.
It
It's
is
not real.
outdated information. It is what we used to think.
So it's not so I was under the assumption that long-term memory, all of it's in the hippocampus. Is that not true?
Pretty much everything your brain does not happen in just one place. In fact, I just learned because I am writing a book proposal right now and I'm doing research into that. And one of the things that I learned was the cerebellum, it turns out.
Mhm.
We When I was in grad school learning about the brain, it was, that's just involved in like mostly motor stuff, very primitive. It doesn't do much of,
Mm.
like you need it for life, but it's not very interesting. Turns out it's involved in a lot of things, one of which is language,
Is that right?
which is like a very higher order function. So that's surprising because it's like a lower, like more primitive structure.
Interesting.
It is interesting. So it's just anyone that tells you with certainty that something in the brain is just for something,
Well,
they are
well,
lying.
I'll tell you what, the vision part of the brain, the vision is everywhere in the brain.
Exactly. That's what I'm saying.
There's so
Like
many
your
places.
brain communicates all
You
over the place.
you name a lobe, I'll tell you how it works with
Parietal.
parietal, that's where one of your optic radiations are
What does that do?
from the thalamus, where your
Mm-hmm.
lateral geniculate nucleus is,
Mm-hmm.
you have radiations that go back through the brain to the occipital lobe,
Mm-hmm.
and they pass through.
Okay, but if it's just passing through, that's not doing
It's all
anything.
passing through. What are you
If
talking
it's just
about?
trying to get to the back, that's
It's
not
just
very
you have
interesting.
neurons that pass through all the different lobes of the
I
brain.
bet that in the parietal lobe, there's got to be some information being shared about what you are seeing so that you know how to move your body and you know what you are touching and feeling and sensing.
The per
That's just a guess. But
you That your optic radiations go through the temporal lobe and the
Yeah,
parietal
but
lobe.
you're
That's why
saying
when
they're
you get a
just
stroke, you
are you saying they're just passing through like a highway, or are you saying they're
yeah.
pulling
No, it's a
over?
highway.
No.
It
I
is.
mean, that is, but I bet there's other stuff going on off the highway,
You
such
just
as,
you just think.
well, I'm not a parietal lobe expert. The parietal and the temporal lobes and the occipital lobes were not really, I was more of like a prefrontal cortex limbic
Listen,
system.
listen,
That's where I
listen.
stayed.
My point is, without vision, the brain would be nothing.
Okay.
Okay? Brain would be nothing without
So,
vision.
to all of the people out there who have blindness, I apologize for my ophthalmologic husband.
I what are you talking about? I'm helping prevent blindness.
You said without vision, the brain is nothing. But I bet people without vision have
Oh, that's
brains that
not what
do
I
things.
meant. Okay. I get it. I get it. I get it. But the point is, neurologists, don't forget, like, we have
The
just as much
eyeballs.
claim over the brain as you do.
Mm, I don't know about just as much.
All right, back to the anterior pituitary. Back to the brain testicles. All right, so other things that are secreted from the anterior pituitary are your FSH and LH. Remember those?
Follicle stimulating hormone and luteinizing hormone.
That's right. That is in charge of
Lady
the
hormones.
lady hormones and the male
The eggs.
hormones and the eggs and the sperm, so they can meet up. You have the ACTH, adrenocorticotropin uh,
Yeah, I don't know about that one.
hormone. That's your cortisol. That's your precursor to
Oh,
cortisol. So
oh, precursor.
it goes to your adrenal glands, and then you
Okay.
make cortisol. And then you have TSH,
Thyroid
thyroid
stimulating
stimulating
hormone.
hormone, goes to your thyroid gland to make
Mhm.
thyroid hormone. Prolactin.
Mhm.
Or prolactin?
That's because we're
Mhm.
mammals.
That's right. Those are and then growth hormone. Also some endorphins are thrown in there too. The posterior pituitary,
Mhm.
the least important pituitary unless you're a nephrologist. They love
Oh.
the posterior pituitary because it makes antidiuretic hormone,
Uh-huh.
ADH, which helps you reabsorb fluid from your collecting ducts in your
Mhm.
kidneys, in your nephrons,
Mhm.
so you don't just pee out. That's why whenever you have when you drink a lot of alcohol,
It's an
ETOH,
antidiuretic.
inhibits ADH, and so you end up just peeing all the
Oh, so
water
it's a
out.
diuretic.
Yeah. So right, so you
Okay.
can't it prevents antidiuretic hormone from acting.
Got it.
So, you can't, concentrate your urine, which is why you get dehydrated.
And why you have to pee so much?
Exactly. You got it. So ADH, that comes from the posterior pituitary as well as oxytocin,
There you go. That's
that
important.
wonderful oxytocin hormone.
Mhm.
Um, all right. That's all I got for you. Is that enough? Is that enough
That
hormone
is
talk for
enough. Can
today?
I talk about one more brain thing?
Sure.
Speaking of the locationism
Yes.
stuff,
Okay.
you know what really is my biggest pet peeve
What?
about brain stuff is when people say the left side of the brain is for logical thinking and the right side of the brain is for creativity.
Oh, yeah,
That really bugs me. That is not true.
well, that's like on the spectrum of like, you only use 10% of our brain.
Exactly, that's another one.
That's
Yes,
dumb.
that's just
I think
not
that's
true.
I think
It's
we
just
all know
nonsense.
that's not true now.
You would be surprised.
I don't wanna put anything past the public. All right. That's it. That's our topic for today.
Yeah,
Thank
we
you.
learned.
Yeah, we did learn. Thank you all for listening. If you have any thoughts on the pituitary gland, or if you disagree with my assessment that they look like little testicles in the brain, please let us know.
We need some merch that says Patua balls.
Patua balls. Is that what I called them? Patua
Yes,
balls?
you did.
Email us, knockknockai@human-content.com. You can also visit us on our social media platforms. We're on all of them, even LinkedIn. You can hang out with us and our Human Content Podcast family on Instagram and TikTok at Human Content Pods. Thanks to all the great listeners leaving feedback and reviews. Oh, we love those reviews. If you subscribe and comment on your favorite podcasting app or on YouTube, and give you a shout out, like at Matt W. Coleman on YouTube said, I scheduled 30 minutes to quickly go over health insurance terminology with some new team members. It took 75 minutes and someone cried.
Oh, no.
It's so hard to understand.
It's the worst.
It's like part of why I did all those videos.
I
Trying to like
know.
explain it to people.
Maybe we need to run those like at least once a year
I-
just to
maybe
help
we
people, like
should.
right before enrollment.
Yeah, that's a
season.
good idea. Just gives us put them all. Maybe
Yeah.
let's just, like put them all back to back. We'll just do like a
Yeah.
1 hour seminar.
Right. You know
That
what
at least
though?
has jokes.
We always say people who comment,
Yeah.
and it's always YouTube. So
Mhm.
listen, we will also read your comment if you post on Apple Podcasts, on
Oh, yeah.
Spotify.
That's
like
right.
it's
Doesn't
not
have to be on
just
YouTube. Absolutely.
Right. We look at all of them.
Full video episodes are up every week though on the YouTube channel at Glauc and Fleckens at Glauc and Fleckens. Also a Patreon, lots of cool perks, bonus episodes, react to medical shows and movies, hang out with other members of the Knock Knock High community. We're there, active in it, doing stuff, early ad-free episode access, interactive Q&A live stream events, much more. Patreon.com/Glauc and Flecken, or go to glaucandflecken.com. All that information. Speaking of Patreon community perks, new member shout out Nora Musk Stork. That must be the Medical University of South Carolina.
Oh yeah, MUSC.
MUSC Stork. Lisa G. Thank you all for joining. And shout out to the Jonathans as usual. Patrick Lucia C. Edward K. Marion W. Mr. Granddaddy. Caitlin C. Brianna L. MP Cole. Mary H. Keith G. Parker. Muhammad L. David H. Kaylee A. Gabe. Gary M. Eric B. Marlene S. Scott M. Kelsey M. Dr. Hoover. Sean M. Ryan N. Jess K. Hawkeye MD. Bubbly Salt. And
Johnny
Shawnee D.
D.
Patreon roulette time. Random shout out to someone in the emergency medicine tier. Shout out to Jennifer S. for being a patron. Thank you, Jennifer. And thank you all for listening. We're your hosts, Will and Kristin Flannery, also known as the Glauc and Fleckens. Executive producers are Will Flannery. Will Flannery.
Blueberry.
By this time, I was like, my words don't come out right. Kristin Flannery, Aaron Corney, Rob Goldman, and Shanti Brook. Our editor and engineer, Jason Fortizo. Our music is by Omer Binsby. To learn about Knock Knock High's program, disclaimer, ethics, policy, submission, verification, and license terms, HIPAA release terms, go to glaucandflecken.com or reach out to us, knockknockhigh@human-content.com with questions, concerns, or those fun medical puns you all have. Knock Knock High is a human content production.
Knock knock. Goodbye.
Hey, Kristin.
Yeah?
You know all that businessy stuff that you like hate to do?
Like all the administrative
Yeah.
paperwork. Yes, that's the worst.
Just like tasks.
Yeah, all the little annoying chores.
We have a lot of that in medicine right now. It's
Yeah.
awful.
Lots of documentation.
But it's where Microsoft Dragon Copilot can really help.
Mm.
This is an AI assistant for streamlining workflow, and it helps to automate tasks that are just like you're talking about. Just kind of just difficult to do, take time, that take you away from things that you really need to do in your line of work.
You know, like practice medicine.
Yeah. So from summarizing notes and evidence, getting key facts and details, prepping orders that you need to, it just helps. It just helps you do your job more efficiently
Yes.
and lets you focus again on that relationship.
And it takes
building.
away some of the cognitive load that comes with all those little annoying tasks.
Absolutely. Drafting referrals and after visit summaries just makes it go faster. To learn more about Microsoft Dragon Copilot, visit aka.ms/knockknockhigh. Again, that's aka.ms/knockknockhigh. Thanks for watching the episode. You can find more on that playlist over there. If you prefer to listen or you just had your eyes dilated, you can binge full episodes wherever you get your podcasts. Or join the party over on Patreon, where you get early access episodes, hang out with us, get lots of exclusive bonus content. Hope you subscribe, leave a comment below. Let us know what you think.